Hello everyone and welcome to this re-recording of the NCETA webinar series. Originally we presented this on the 12th of October and this is a recording of the same presentation that due to technical difficulties we needed to do another recording. So I'd like to take this opportunity to welcome you to this webinar. The webinar is focused on the AOD National Workforce Survey that we conducted from 2019 to 2020. NCETA is going to have a series of webinars unfolding once a month, so look out for more information on those. You can find us on Twitter and Facebook. You can go to our website, and of course we'll be sending out emails as well. Before I begin the presentation, I'd like to acknowledge the traditional owners of the land on which I present this webinar today, the Kaurna people. I'd also like to pay my respects to elders, past, present, and emerging. I'm going to move out the way of the slides now so you can see the full slide. I'll just be here on the side. I'd also like to acknowledge our funding partner, the Australian Government Department of Health, and for the Victorian component of the data collection, the Victorian Department of Health and Human Services. We were very lucky to work with an excellent expert advisory group on this project. I've listed the people in the expert advisory group on this slide, and we'd like to thank them very much for their input and contributions to the survey design and dissemination and interpretation of results. Also acknowledging other key stakeholders and supporters, the Victorian Department of Health and Human Services also provided us with an expert advisory group to work with for the survey content for the Victorian and the National Survey, so we thank them for their input. Special thanks to the Australian AOD Peaks Network, who helped us with survey promotion and dissemination. The NCETA team that contributed to this project is listed below, led by Professor Anne Roach, and myself as project manager, and various other NCETA team members contributed, so thank you very much. Finally, our biggest thank you goes to all of the respondents who took the time to share your views and experiences in the survey, and hopefully some of you are watching this webinar today. Just a quick reminder about the resources that are available from this survey and the wider project. We have a national report which highlights major trends and insights. You can see the front cover of the report there on the slide. We've also developed a series of infographics which really provide with very useful at-a-glance insights into major aspects of the AOD workforce profile, employment conditions and worker wellbeing. We've received some really positive feedback on the infographic resources, so thank you very much for that. We have developed a full user manual which provides you with the complete survey protocol for the national survey. So this means that we provide you with every single item that we use in the national survey, and we give you information about the sources of those items and how to interpret the items in terms of how to develop single items into scales where we use multi-item scales. We also provide you with a comparative data resource. So what we've done here is created an Excel spreadsheet where you can look at summary data on key survey items, so that if you choose to use the full survey protocol or parts of the survey protocol in your own surveys, you have some comparative data for which you can compare and contrast your results with our national survey findings. All of the resources that are listed here are on the NCETA website. I've given you the web address below. I should also mention that you can obtain a copy of these PowerPoint slides from that website, and also, of course, the recording of this webinar. I wanted to start off just with some headlines just to give you a sense of what I'll be talking about today. What we found from this survey is that we have a very diverse workforce in many ways, and I'll be walking you through some aspects of that diversity. We're a very well qualified workforce, and we're also a highly dedicated and motivated workforce. Also very important to knowledge is that AOD work is very demanding in particular ways, and I'll be exploring some of the wellbeing implications of that with you. And also I'm going to finish the presentation by exploring some key workforce development areas that our survey findings highlight. And these include things such as professional development, addressing advanced skills, more support in regional areas, and some cross-sector and systemic issues that were highlighted, particularly in the open text responses from survey respondents. Just an overview of the method. You can get more information on the method from the national report, but I just give you a sense of the essential parts of how we went about developing and disseminating the survey. So for the development of the survey, the content of the survey, we went to existing jurisdictional surveys. So every state and territory has its own survey program. Often there are survey programs for the government and the non-government sector. So we looked at those instruments, and as far as possible, we tried to obtain consistency between those surveys and our national survey. We use validated survey instruments from the research literature. And of course, we are also guided by input from the NCETA team and our expert advisory group. We collected data from August through 2019 through to February 2020. This was a bit of an extended data collection period, and part of that reason was because we wanted to invite survey respondents from the NGO, government and the private sectors. Now the NGO and the government sectors have different requirements in terms of the ethics and the research governance processes that we need to go through. In some cases we had to go down to the level of each local health district within a particular jurisdiction, and that took some time. We use various recruitment channels to disseminate the survey and invite people to participate. As I mentioned before, the AOD Peaks Network were crucial in supporting us in disseminating this survey invitation. We use social media and we also use direct outreach towards particular AOD organisations. So thank you very much to all of those people who assisted us in agreeing to distribute the invitation to their colleagues and through their organisation. We had just over 1,500 respondents to the survey. We deliberately recruited a range of respondents. So of course we had the AOD specialist workers, so people who are providing frontline services to clients. We also deliberately targeted any workers in an AOD organisation. So we're talking about people in any role, people who provide direct client services, people in policy, research, administration, advocacy, and so on. And as I mentioned, we recruited people from NGO, government and private sector. I've just listed below our major research ethics and governance committees, just for your review. And we also went to particular jurisdictional ethics and governance bodies as well, where we were required. Just on to some of the key findings from the survey. I'd like to start with an overview of the workforce profile in terms of social demographics. So I have said that the workforce is quite diverse, and it is very diverse. Although it's not very diverse on gender, we found the majority of our respondents were female. And that is also, of course, reflected in the general trend for the health sector as well. 44% of our respondents were carers, so they had caring responsibilities for a child, an older person or another person. We have quite a mature workforce, so 40% of our workforce are aged 50 or over. 6% of our respondents identified as Aboriginal and or Torres Strait Islander, and a quarter of the survey respondents were born outside of Australia. So quite a diverse workforce in terms of people's circumstances and their backgrounds. We found that the majority of people, 65% of people, reported some form of lived experience with problematic AOD use. And I'll unpack that a little bit for you in a minute. I just also want to reflect on the diversity of employment characteristics within our workforce. So on the left-hand side of the slide, you can see Australian Bureau of Statistics categories for occupation. This is a little word map that we've created, and you can see there's quite a wide range of occupations that were represented in the survey. Of course, as you'd expect, the most common occupations are drug and alcohol counsellor, drug and alcohol nurse, and social worker. Another way to capture the diversity of our workforce is to look at where people were working before they came to the AOD role. And again, from the word map, you can see there's quite a range of sectors that people came from into the AOD field. Of course, as you'd expect, the majority or many people are coming from primary health, mental health, and community services. But there's also a range of other sectors there which might be a little bit surprising. We've got people coming from retail, construction, housing, from disability, hospitality, youth sector, and so on. So again, these word maps and also our social demographics indicate that we are an incredibly diverse workforce. That has its own strengths from a workforce development perspective because, of course, the clients that we are serving are also very diverse and come from all sorts of backgrounds in terms of their social backgrounds and their employment and work backgrounds. But it also presents some challenges for workforce development, particularly around how we ensure high-level professional development and good access to professional development for people from various backgrounds and with various levels of skill. A little bit more on where our workforce is based in terms of the sort of roles they're doing and the settings in which they work. The majority of our respondents were in direct client service work, so 71%. Now, people could select more than one work role, so you can see that around a quarter of people said that they had a management role, and almost 20% of people said they were also involved in project work. When we look at the setting in which people are working, again, people could pick more than one setting. So the most common settings were non-residential treatment settings, and also around a third of our respondents were in an office setting. Around a fifth of people said they worked in outreach or residential treatment. Again, remembering that people could select more than one setting in which they work. Back to the lived experience finding for a moment. So I mentioned previously that 65% of people reported some form of lived experience. Of those 65%, the majority, 68%, almost 70% of people said that my lived experience is related to a family member. Almost half of those with lived experience said it was a personal experience, and 15% of people said they had another type of experience. Again, people could choose more than one type of lived experience. So people might have picked all three or one or two of those types of experiences. I think the important thing to recognise here is that the majority of people in our workforce are likely to have some form of personal lived experience with AOD use and problematic AOD use. We also wanted to unpack what it's like to be a person with lived experience, to be in the AOD workforce. When we asked our respondents, we found that almost 40% of people said they did not disclose their lived experience to their workplace. The majority of people said that they didn't feel that there was a need to. So 61% of people said had no desire or need to disclose. Again, people can choose multiple reasons here. Around a third of people were concerned with confidentiality or privacy. And around 30% of people did not disclose their lived experience because they were concerned about stigma. And I think that's a really important finding for us as a sector to reflect on. I know there's a lot of advocacy work on behalf of clients to destigmatise drug and alcohol use, which is such important work. But what we're also seeing here when we explore why do people not disclose to their workplace their own lived experience, there seems to be still a concern over stigma, possible discrimination from the AOD workers themselves. So we've still got some work to do in terms of looking after our own workforce as well as our clients in terms of addressing stigma. Moving on to qualifications. I think we can say from our findings that we have a very well qualified workforce. So when we look at all workers, so that's people in any work role, the majority, almost 60%, held a general tertiary qualification, so a university degree or higher. Looking at everybody, almost half held a vocational or a tertiary AOD qualification. And when we just look at client service workers alone, 67% of people in direct client service work held a vocational or a tertiary AOD qualification. So it's pretty easy to do the maths there. You're thinking, well, 33% of people in direct client service roles didn't have a specialist vocational or tertiary AOD qualification. So when we unpack that a little bit, we do learn a little bit more about who these people are. So those without an AOD vocational or tertiary qualification, 16% of that group were currently enrolled in a qualification, and almost a quarter of that group were counsellors, so who one would assume already have a vocational or tertiary qualification. It's important to acknowledge also that this data is for the national survey for all of Australia, and particular jurisdictions might have different outcomes in terms of qualifications of the workforce. For example, in Victoria, they have their minimum qualification strategy, which is associated with a different level of universal qualifications for the AOD workforce in terms of holding a vocational or tertiary AOD qualification. Looking at professional development, most respondents said they had good access to professional development. So almost 90% said they had participated in some form of professional development over the past 3 years. However, almost 40% of people said they had difficulties accessing professional development. This was due to financial costs, either to themselves or the employer, or having insufficient time at work or outside of work. When we asked people, what would you like more professional development on? We got some quite consistent responses when we offered people a list of options, and we did only give people an opportunity to select our top 3, so they couldn't select everything on the list. What really comes through here is that our workforce is asking for more professional development on complex, multifaceted issues, such as working with clients who have experience of trauma, clients with dual diagnoses, and responding to clients with multiple and complex needs. For example, clients who might be experiencing homelessness and an AOD issue. People also commonly reported that they'd like more professional development on clients with experience of family violence and forensic AOD clients. When people were asked, are there particular groups that you'd like to work with, what was quite common was that people were requesting to have more professional development with clients who are Aboriginal or Torres Strait Islander, and more development and training on working with families and with children. If you'd like the particular statistics to do with each of these professional development needs, you're very welcome to go to the national report. So here I'm just giving you an overview of the most common areas of identified need in terms of professional development. Moving on to employment conditions. So training, qualifications, professional development, these are the foundational issues of workforce development. But something that NCETA has been promoting for a long time now is this idea that, of course, these are the foundations of an effective and skilled workforce, but what we also need to make sure is that people are working in employment and working environments that support and enable them to work most effectively, and that ensure that we recruit and retain a workforce that is sustainable. And this is very much about employment conditions can enable us to achieve those outcomes. I want to start with the strengths of our sector. My background is in organisational psychology and work psychology, and I can tell you that some of these strengths are quite extraordinary and unique to our sector. 75% of people said they had a permanent job, so an ongoing employment contract. Now, this is pre-COVID, mind you, so we finished data collection in February. However, that's still very good compared to many other industries in Australia and also overseas. Only just over half of people were satisfied with their pay, and I'll return to that in a minute. Already mentioned, the majority of people have access to professional development of some form in the past year. And almost 90% of people have access to clinical supervision or practice support. There's good evidence that our cultures in AOD organisations are pretty good. Around or over 70% of people felt supported and respected in their workplace. And the next statistic is quite extraordinary. 93% of people agree that their work is meaningful. This is very unusual. I can tell you from a work psychology perspective that it is almost unheard of that people in any particular industry or sector would say that the majority of people would say their work is meaningful. This is a huge area of potential for our sector, tapping into this sense of motivation and commitment. The majority of people were satisfied with their job and the sector, and also the majority of people were satisfied with their career progress so far. There's a lot of strengths there. It's important to acknowledge them. However, we also have some significant challenges in our sector. Work intensity. Nearly 60% of people felt under constant time pressure from heavy workloads. This is a very important statistic because I can tell you from the research literature that working under conditions of work intensity is one of the strongest predictors of some really important outcomes, such as turnover, burnout, stress, decreased job satisfaction, and so on. Linked to this sense of work intensity, around 40% of people said that they worked overtime or extra hours at least weekly, and almost a quarter of these respondents weren't compensated in any way. So they didn't get time back and they didn't get any financial compensation. Nearly 30% of people were unsatisfied with their pay. This is not really surprising when we look at our average pay levels in our sector. So we observed that 42% of full-time workers had an income below the national average. So there's definitely some work we need to do in looking at our award rates, our levels of remuneration in our sector. I've already talked about access to professional development. The next statistic is interesting. Only 44% of respondents were satisfied with their future career progress. So, as I mentioned on the left-hand side of the slide, 70% of people were satisfied with their career progress so far, but only less than half of our respondents said that they were satisfied with future prospects. So there seems to be a ceiling effect here where people are feeling they only get so far and then they can't see where the next step is in terms of progressing their career and their professional development. Another surprising statistic that we observed was that only just over half of our respondents said that their organisation was open to innovation. This was not expected, and we're still unpacking exactly what this means. But it is a concern if we think about the support that we want to offer to evidence-based practice, and often that can mean changing the way that we do things in a small way or a big way. And that means we need organisations that are open to innovation and change. But at the moment, it looks like only half of our workforce feels that they work in one of those organisations. And we're definitely going to explore that a little more in future work. Psychological wellbeing in the sector is also a challenge, and I'm going to unpack that in a slide in a minute. I want to talk just briefly about workforce sustainability. We have a mix of very experienced and relatively new workers in our sector. So we have 40% of workers who are very experienced with 10 or more years in the sector. And also at the other end of the spectrum, we have almost 30% of people with less than 1 year or up to 3 years of AOD experience. This is quite a bifurcated pattern of very experienced and really quite inexperienced workers. In terms of sustainability, we have observed that with regard to the whole sector, turnover intentions are relatively stable. Only 14% of people said that they intended to leave the sector within the next 12 months. However, almost a quarter of people said that they were seriously thinking about leaving a job within the next 12 months. When we asked people, why do you leave? People identified the issues that were also identified on a previous slide as challenges: stress, burnout, high workload, poor quality working conditions, and a lack of career opportunities. So there's definitely some strong messaging coming through about the workforce development areas that our sector needs to do some more work on. I want to talk about wellbeing. This is a particular area of interest for me. And I want to start by observing that AOD workers are very resilient. There's a pattern here that I'm going to share with you that is, I think, probably fairly common in health and human services work. And it has some really important implications for our workforce development strategies. Starting with the good news. 3/4 of people are enthusiastic about their job. The majority feel that they're in good health and have a good quality of life. These are really good foundations for health and wellbeing. The enthusiasm statistics is worth noting. In general, in the work and industrial relations research literature, it has been observed that we have a lot of challenges with people not feeling engaged and motivated in their work. So this is a real strength of our sector. But we do have challenges. 13% of people reported high or very high degree of burnout, and 30% of people felt somewhat burnt out. So overall, around 43% of people were experiencing some level of burnout. That's quite high. It's also consistent with other research in Australia and overseas about high rates of burnout in our sector. This statistic, the next statistic, really caught my eye. 1 in 5 of us always or often feel exhausted in the morning at the thought of another workday. Exhaustion is a key component of burnout, but it's also a key factor in issues around fatigue. And fatigue is a very important issue both for health, but also for safety at work. So I think we really need to pay attention to these findings in terms of how overloaded people are, how intense they are feeling that their work experience is, their workload is, and also circling back to those issues of overtime and unpaid overtime. We also have a core of around a quarter of people who seldom or only sometimes feel enthusiastic about their job. So the way I'm reading this is that overall, we are quite a healthy and resilient workforce. However, I'm feeling that there's probably a significant group of people who are really struggling, have high levels of burnout, high levels of exhaustion, and are struggling with feelings of dedication and commitment. I want to just reflect on some of the priorities that we're identifying from our findings. The NCETA team is going to do some work to further progress our analysis and put out various ideas around strategies, workforce development approaches. So this is just a preliminary overview of the implications of policy and practice that we are reflecting on from the survey. Professional qualifications and development. Just highlighting again that it came through very clearly from both the quantitative aspects of the survey, but also from people's comments in the open text area of the survey, that there is a strong need for more professional development on complex issues, more advanced training, especially for those people who have 10 plus years of experience in the sector. There's a very clear message from that group saying that there's a lot of foundational training available, but there's not training to help people extend into more advanced skills. Employment conditions, there are some really significant challenges here. I think the sector has an issue with fair remuneration, and this was something that was also echoed in the qualitative open text responses from the survey. People were talking about the level of remuneration, which when I look at the data, also we know that many people are paid below the national average income. Our survey respondents also said that their pay doesn't reflect the complexity, demand and skill that they offer in their role. And as I've also mentioned, we have an issue with unpaid overtime. There is also an issue with work intensity and feelings of work overload, a lack of career opportunities for people to feel that they can progress in their work and their career. And I've also flagged there's potentially an issue that we need to explore further around organisational cultures or capacity for innovation. I want to acknowledge that many of these issues that are on this slide not only reflect issues within an organisation around management and culture, but they are also strongly influenced by systemic issues, including funding arrangements and other requirements that sit outside of specific organisations. Systemic issues really came through strongly in the open text responses from the survey. People were sharing a lot about the funding models and the adequacy of funding for AOD organisations. There was also reflection on the challenges of cross-sector cooperation, for example, as an AOD worker or an AOD organisation collaborating with people from different sectors such as the housing sector, mental health. There were some reflections on leadership in AOD organisations, leaders and managers, reflecting on perhaps we need to have a stronger focus on offering professional development and skill development for our leaders and managers in our organisations. And also we are, as I reflected earlier in the presentation, there's still ongoing issues of stigma with AOD work. So we're very aware of stigma for our clients who might be using drugs or alcohol, but also it's still very clear that people working in the sector still feel that there's also a stigma with the work itself. So coming through really strongly was workers in regional and remote areas have particular difficulties with accessing professional development, including those issues around accessing advanced training and also issues with recruiting sufficiently qualified workers, as well, of course, as the challenges and issues that I've already reflected on seem to be particularly exacerbated in regional and remote areas. I'd just like to finish with a reminder. Please go to the NCETA website for our national report and infographic resources so you can get more information on the information I presented today. You can access our national survey protocol, which contains the full set of survey items and comparative data, the slides and recording of this presentation. You will receive updates on our publications and other resources, including our monthly webinar series. And please look out for a series of papers and other resources that we're developing to look further into many of the issues that I've highlighted in this presentation today. I've given you the website there, my email address. You're very welcome to contact me with further queries or comments. I have a set of additional slides after this one, and in the original webinar, we requested that people tell us what is their burning issue or their particular topic that they'd like covered in this webinar. And so I've included those comments also in this presentation, so you can access those slides by downloading the slide set from our website. This will also hopefully give you a sense of what your colleagues and co-workers are thinking about in terms of the high priority workforce development issues in our sector. So that's just included for you to have a look at if you're particularly interested. Lots of issues being raised there. So thank you very much for joining me for this webinar. And if you have any questions or would like to make further comments, you're very welcome to contact me directly. Thank you.